Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. Now we are going to talk about surgery, how to prepare for surgery. I'm going to give you an overview of what to expect and what to do. So let's get started. So if you're getting surgery for your cancer, then in a way, that's a pretty good sign, because that means your tumor is localized in a particular area, either fully or at least to a significant amount that it can be taken out, right? So surgery would help to remove that tumor, remove that cancer that is in our body, and help with getting that addressed. In a way, it's a positive sign. With surgery, of course, there is planning for the surgery. So let's talk about preparing for your appointment for surgery. So usually, if based on the kind of cancer you have and how localized your cancer is, your oncologist would be involving a surgeon in this process, and then they would be seeing you for the appointment. Now, many times they would ask you to either do certain tests before, diagnostic testing before or after your appointment, so they can determine the extent of the spread of your cancer, the tumor, how much can they visualize so that they can prepare for it. So if you are getting surgery, if your providers asked you to do certain tests, then make sure that you have those tests done before you go for your appointment. Find out who your team is, who your surgeon is, what their experience is, what are they expecting from you, so that you can go in prepared for your appointment. I usually suggest taking a paper pen to write, take notes. Some surgeons are okay with the recording the conversation, others may not be okay with that. So you can check with them. If they're okay with it, you can record the appointment. If you want to bring a loved one along, you can do that, or you can call them on the phone to join you on the phone for this appointment. With these surgeries, when we are giving you, when we're discussing the surgery with you, we will be explaining to you. So when I say we, I'm talking in my capacity as a cancer nurse, as somebody who teaches about this. We will do our best to explain what the surgery is about, right? And then as a loved one, or as somebody who's gone through surgeries, I can say that, what I'm trying to do in that moment is trying to understand the standard questions, right? What, why, when, where, how, whom, right? So what is happening? Why is it being given? How is it going to be given? When? What can I expect? What is the outcome I can expect from this? What are the risks associated with it? And what is expected from me so that this can be a success? What is it that I can do in this regard? Usually, you would be discussing these things with your clinical team. If you have any questions, you can prepare your questions, get those ready. If you have follow-up questions, then ask them how you can ask those questions. And then when you get the consent form, make sure you're comfortable, you've understood, and then you can sign the consent form. The team should be discussing with you the details of the operation, benefits, side effects, recovery process, all of that. Okay, and then what do you need to do to prepare? So that's an important point to think about, is you want to ask them, what is the pre-op preparation, as in before operation? What is the preparation? What do you need to do? And then what is the post-op process? So what is it that they are going to do after your surgery? And what is it that you and your loved one need to do? Also, you'll want to find out if there is some rehab support available for you before or after, as in after the surgery. How long is it going to take? What are the kind of things that you will be able to do and not able to do? And could you get some help for recovery, whether that means you have somebody who's helping you, coming, and a nurse helping you with your activities of daily living at home, or is it that you may need some physical therapy or some other kind of therapy? Then those kind of things you would want to find out. Also, if you would need any kind of adjustment or setup at home, like bars in the bathroom or things like that, again, those are things that you would want to ask, find out, and get those resources set up for you. Okay. Now, in terms of based on the surgery you're going through, there could be some tests that are done. Your provider, your doctor, and the medical team is going to decide those tests. So you just need to know if you're getting certain tests and what you need to do to be prepared for those tests. So if you need to be NPO, as in not eat or drink anything on the day off or 24 hours before, then that's something to be aware of. One point I recommend to all my patients, and also when I have done this, is to get a copy of your records. So sometimes what's happening is that your tests are being performed at another site, and your cancer specialist is at another site, your radiation is at another site. So things can get a little bit spread out, and they may not have a complete record, but it's good for you to maintain a complete record. So on paper or on electronically, maintain a complete record. So like when we go through our NCC program, people who are in the program, they have a place to store all their files and documents. So you want to keep track of all of this so that you are aware of what's going on, and then you have your full history with you. And if you need to discuss something or give a particular document to another provider who's involved in your treatment, you can do that. So when you're getting these testing and procedures, I recommend that you keep a copy of all your records and keep them organized. Now, before your surgery, some things that can affect your surgery is what medications you're taking, alcohol, tobacco, diet, but also what is your strength, your physical strength, if you're getting something that affects your physical energy. So you will want to understand what is your baseline and what you can do to prepare, almost like preparing for a marathon, right? So what you can do to prepare so that you can have the best outcomes possible in each of this regard. So now when you are preparing for your surgery, on the day of the surgery, you'll want to leave your jewelry and valuables at home or with someone, because they will be asked to remove all the jewelry. If glasses rather than contact lens on the day of the surgery. And depending on the kind of surgery you're getting, you may be asked to remove makeup, but you can always wash it off while you're there. That's fine. You want to wear comfortable clothes and know that you might be you'll be removing your clothes and you'll be putting on a gown. It's helpful to bring a family or friend with you so that you have someone with you on that day. And that way your provider, your medical team, your clinical team can update them about what's going on with your treatment. Sometimes things may take, it's possible that, your surgery was scheduled for, let's say, 9 in the morning, but there was some critical case that came up, some emergency that came up, and it could get pushed back by 2 hours or 3 hours. That can happen. Or the previous surgery ran longer. So, as much as the team plans to be on time, those things do happen. You can bring something with you to read, or your phone, download some fun things to watch. If you watch on Netflix or Hulu or whatever, you can keep some things around to watch, or some some music, some books to read, so that you have, if things take time, you can you can keep yourself occupied. Surgery can be anxiety provoking. Even as you can see, even as I'm talking about it, I feel a little nervous when I have had to go through surgery, or I've had loved one go through surgery, even though it's an area I work in every day. So think about how you can calm your nerves. On the day of the surgery, what can you do? What helps you with calming your nerves? What helps you with stress reduction, with relaxing? Think about those, bring those things along with you, and plan for that. One thing I find really helpful is to visualize, do positive visualization for your surgery. So imagine that your surgery is going well, you walk in, everything worked out, you went for your surgery was successful, you woke up, and you are on your recovery. So having that visualization can be very helpful because you're thinking from that place of grounding, from that place of positivity. If you have certain phrases that can help you, you can do that. There are surgery specific meditations. So you can use those if that helps you with grounding and with calming yourself during this time. Okay, so now let's talk about more specifics. So during surgery, they would be using some form of anesthesia, that is to numb the pain. So it could be local anesthesia if it is, if it is something that's given locally and it's small, or it could be topical, as in it's just applied on that area. Like if we are inserting a port, for you, then we will apply some local anesthetic, numb that area, and then apply the port. Or it could be regional, or it could be twilight. Twilight is like a mild dose anesthesia that is given, or it could be general anesthesia that's given for the whole body. So depending on the anesthesia that's given, you'll accordingly be conscious or unconscious, and it can take a little bit time to come out of it, and then take some time to kind of get back into the world. Take that time to orient yourself, sit up slowly, get up slowly, hold something so that you can stay safe. You might feel a little bit groggy after the surgery. You might feel sore at the site of the operation, or some pain. So no, that's likely to be there. So you'll be monitored for those things, but always talk to your team or communicate with them about what you're feeling, what's going on with you, and how they can help you, because sometimes they may not know what you are going through. If they know, then they can help you with that. Anesthesia takes some time to wear off. So usually we'll be keeping you at the site for some time until it wears off. When you're getting discharged from your surgery, there might be a wound or a cut where the surgery took place. So there might be some wound care to do, or there might just be simple replacing the bandages to do. But whatever it is, make sure you've understood what needs to be done, and when and how, and what is the equipment to use. How do you keep that area clean to prevent risk of infection? So make sure you've understood those things before you're going home. That's why it's good to bring a loved one along. See if they can give you handouts, or if they can give you videos and resources on how to do certain things, or give you full names of those things so that you can find videos online. When we are working with you in our NCC program and in the consults, private consults with you, we will discuss all these items. We will figure out these different topics with you, make sure there is a plan, and ensure that you have the right resources to know what to do. Also, when you're going through surgery, it may affect your activities of what you can do. So make sure that you are asking and finding out about it, so that you are aware and you can be mindful about those. In this regard, what I would say is find out what you can do and what you cannot do, because sometimes I see both sides. So it's possible that we are supposed to take rest and not do certain things like lifting or bending and lifting something heavy, but we do that because we feel we need to, but it's important to know and know till when not to do it and slowly build up. And other times it's important to actually go and walk and do some exercises to get the body moving and to train our muscles. But because after surgery we feel so tired and just so wiped out, we are not doing it. So with activities of daily living, or with activity limits, find out what is it that you should not do and what is it that you should do, so that you can get back in the energy and at the same time you can keep yourself safe. Okay, so those are the restrictions. Medications, you'll want to know what medications you need to take, when you need to take them, how often you need to take them, what happens when you have more pain, and what happens when you feel certain things, what kind of medications to take. Also, with medication, one important point I want to share is sometimes we give you medication saying if you have breakthrough pain, or if you feel certain thing, you can take this every 4 hours or every 6 hours or however often. Sometimes that information can become a little bit unclear because there's just so much happening. So I've seen in some cases where the intention was to say take it if you need it, but by accident that person may be taking it every 4 hours or 6 hours because they thought I'm just supposed to take it. So make sure those differentiations, you're becoming clear about those, about what is needed to be taken and what you can take. We will go a lot into pain management in the next section, so we'll talk about pain management there. But other than that, any other medications, do remember to get all the details. Any special instructions that you need to follow, anything you need to do, you want to become aware of that, get details and information on those. And any symptoms that need to be reported, like chills, fever, bleeding, any bruising, difficulty breathing, any unusual pain, are typical symptoms that would need to be reported immediately to your medical team, to your clinical team. So get that list from them. Most places should be providing that information. Have that handy with you. Have a loved one with you or a caregiver who can come and check on you if you're alone, and they can observe these symptoms for you. Have your medical information handy for them. Okay, recovery process. So in the recovery process, that's where, it will take some time for recovery. So make sure you're giving yourself enough time for recovery and understand what that process can look like. So physically, how do you get better? How do you scale up your activities and your energy? What about your diet? What you can do? How do you track your symptoms? I suggest using some kind of journal, whether electronic or paper journal, for tracking your symptoms so that you can be aware. If you need to change your bandages, then again, get information on that, how you can do that, what you need to do, your hygiene and pain management. All these are important points. How long will it take to recover? This is an important question. And this is something you'll want to discuss with your team and with anybody who's affected with your life, right? Once you know, okay, this is something that's going to take 2 weeks or 4 weeks or 3 months, whatever that time frame is, find out about that. I suggest add a buffer time, because it takes time even after you're okay to actually be okay. Or body doesn't work always as a clock. Things can happen. So if the expected recovery time is, let's say, 4 weeks, I suggest you give yourself 6 to 8 weeks, so that if there is any ups and downs, you've given yourself that time. So if you are planning to return to work or go back to certain responsibilities that you have, give yourself a little bit of that buffer time, and also talk to your team about that in advance so you're aware of it. So in summary, you want to understand what is happening to you, what you're being given, how it is being given, what is going to happen, and then give the team what they need so that they can give you a successful result. They can do their best to give you a successful result. So your past medical history, your medications, things like that, and then do what you can to be prepared for it and to have the best outcome. So how can you prepare beforehand, before the surgery? Physically, mentally, emotionally, logistically, financially, so that you have all those things taken care of. And then how can you work on your recovery so that you can have have a smooth recovery and get back to the most optimal state that is possible for you, right? And throughout this process, I hope you have a team around you, your clinical team as well as medical team around you to help you and support you in this journey. If we can be part of that team for you, we would be privileged to do that. We are a telehealth palliative clinic, so we are able to provide guidance and support, and we have group programs and consults as well. So we can be part of the team if you need us to be. But regardless, I hope you found this helpful. And I know it can be daunting. The surgery that is associated with your cancer can help to remove that cancer from your body and get it out of your system so you can go back to the life you had. So I hope that this information helps you to be prepared and helps you to have the best outcomes possible and to be cancer-free as soon as possible. About the caregiver. Okay, so I think as a caregiver, like we touched on before, you'll want to know after with surgery. So you'll want to know what is going to be the impact of surgery on your loved one. What are the things they'll be able to do and what they will not be able to do. So then based on that, you will want to have a plan around the questions that we talked about. Who's going to help with the bathing? Who's going to help with feeding? Who's going to help with medication tracking? Who's going to help with wound care? Things like that. So you'll want to get as much details as possible. And you'll also want to get recovery time as much information as possible. Yeah, I see the question about the timing. Yes, I recommend to give yourself additional buffer time, because sometimes things may take longer. Body is not always perfect, or there may be something that we don't know. So it's better to give yourself some additional time. What if the team is busy? As healthcare professionals, we are trying to do our best and offer all the time that we can, but there's definitely a significant imbalance in the amount of time that is needed versus the time that is available from specialists. So that's where, we're trying to give all this guidance and support and empower you beforehand so that you can be ready. So of course, as much as possible, prevention is the key. So preventing complications from occurring. But if you do feel you need help and you need guidance, then always feel free to contact your team, your surgery team. They would be able to give you a call back. So their nurse or social worker, somebody on the team will be able to give you a call back. If you're not feeling well, go to urgent care, go to ED, get help if you need, if the center is not able to help you. Some centers will have a navigator, so you can use the navigators to guide you and support you if there's a point of contact. We serve as navigators. Our clinic serves as navigators for some of the cancer centers and for some of the cancer patients. So if we have spots available, we will try to serve you as well, if it's based on the state where you are located in and the kind of services that you need. But yeah, definitely it's helpful to have some guidance and support. But if you don't get a response, then call back. It's not because people are ignoring you, it's just that they may have been too slammed. So send them a message again, call them back. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which are put in the description below. Thank you, and my best wishes to you on your healthcare journey.